My name is Darrin Lee, and I'm a neurosurgeon here at the University of Southern California. Today I'm here to discuss the outcomes following the surgical treatment of normal pressure hydrocephalus. There are three potential surgical options, the first being ventriculoperitoneal shunt, the second being lumboperitoneal shunt, and the third being endoscopic third ventriculostomy. In order to determine the right surgical procedure for you, we have you enter our multidisciplinary normal pressure hydrocephalus clinic, which includes neurologists, urologists, radiologists, physical therapists, occupational therapists, and neurosurgeons. Before undergoing surgery, it's important to determine if you're the appropriate candidate. With careful patient selection, up to 90% of patients can have significant improvements in their symptoms. Surgery for normal pressure hydrocephalus will oftentimes improve the three cardinal symptoms of NPH, including gait and balance issues, urinary incontinence, and cognitive changes. Oftentimes we say immediate or rapid improvement in balance following shunting or CSF diversion. However, with urinary incontinence and cognition, it may take up to weeks to months to improve. In general, gait disturbances improve more than urinary incontinence and cognition. Moreover, a shorter duration of gait disturbance often will predict improvement in your gait following surgery. With any surgery, there's a certain amount of risk. Complications include infection and bleeding. We take multiple measures to prevent those complications. There's also a possibility of overdrainage of the cerebrospinal fluid. In order to prevent this, we will oftentimes discuss placing different types of valves to be able to regulate the amount of fluid coming out of the brain. In addition, there's also a possibility of shunt malfunction, including kinking off the tube becoming disconnected, or even potentially obstruction of the tube. Each of these complications can be dealt with. With that in mind, we have regularly scheduled visits following surgery to evaluate you and to adjust the shunt as needed. Here at USC, we pride ourselves in having state-of-the-art technology and treatment options. In addition, we are dedicated to understanding the underlying pathophysiology and mechanisms with regards to normal pressure hydrocephalus. With that in mind, we have a robust research program here at USC to try to understand the underlying problems with normal pressure hydrocephalus and to potentially develop new treatment strategies. We look forward to meeting you and discussing our approach to normal pressure hydrocephalus here at USC.